Well, good afternoon. Yesterday, we laid out a roadmap. We have a path forward, and we have to remember that reopening the economy is a process, and it will take some time to do it right. Yesterday, we presented a decision-making framework to guide us. This framework is the start of the process. We've already seen positive progress on the criteria we laid out. And later this week, we'll be releasing the next step in this process. Clear sector-specific labor guidelines for how businesses can operate safely in this new reality. Having a clear framework, having well-defined labor guidelines, these are critical steps to opening the economy safely. These criteria and guidelines will be based on best medical advice and scientific evidence available. Because in the coming days and weeks, as we move to open more and more parts of the economy, as more and more workplaces open up, having clear safety guidelines in place will be critical to keeping COVID-19 at bay. And putting these pieces in place will help us move as quickly as possible to reopen the economy safely. And we can't do that critical work without talking to our job creators and entrepreneurs. As I've always said, our small business owners are the backbone of our economy. Before this crisis, they employed millions of Ontarians. We know they've been hardest hit by this terrible pandemic. It's my job, it's our job, to help keep them whole and to help them adapt to this new normal, this new reality. So when we're ready to reopen, they can hit the ground running. That's why we provided over $10 billion in tax deferrals, WSIB, premium relief, and other business supports. We're delivering a $900 million program to provide commercial rent relief to small businesses and landlords. We cleared the way for restaurants and bars to sell alcohol with their delivery and takeout orders. And we allowed 24-hour deliveries so grocery stores and pharmacies can keep their shelves stocked. But we want to do more. We want to help our small businesses. We know it's not business as usual right now. And we're working with businesses to remove barriers and help them adapt. Because by working together, we'll get through this crisis and come back stronger than ever before. Together, we will ensure Ontario is ready to power Canada's economic engine once again. Now, I'd like to pass things over to Minister Sarkaria. Thank you.
Good afternoon, everyone, and thank you, Premier. As Associate Minister of Small Business and Red Tape Reduction, I've been holding regular virtual roundtables with small businesses from every corner of Ontario. Our government, in partnership with our federal partners, has taken the necessary steps to protect public health, support our families, and safeguard our economy, such as last week's Ontario-Canada Emergency Commercial Rent Assistance Program. I am always encouraged with how small businesses are pitching in to help conquer the challenge ahead and proposing ways to work together so we can end COVID-19 and recover faster. From hearing from those on the front lines in health and elsewhere on how simple changes could help them do their job better, and for businesses who tell us what they need to do to retool their operations or continue to operate despite these challenges. This is why we are launching a new regulatory website portal called COVID-19, Tackling the Barriers. Through this portal, we want to make clear the hurdles standing in the way of the most effective and efficient response to COVID-19. Particularly, we are looking for temporary rule or regulation changes that would make it easier to assist our healthcare system in meeting emergency needs, help businesses retool operations to produce health-related products and supplies, and help businesses operate in new ways in the face of unexpected challenges. This feedback will help us prioritize the most pressing concerns and determine where temporary changes to regulations, process, and requirements make the most sense. Feedback from frontline staff, business owners, and others about their challenges with processes, rules, and regulations has already helped our government tackle some very pressing concerns, including enabling trucks to deliver 24/7 to keep food and other necessary supplies on store shelves, improving protection for seniors in retirement homes by allowing for more flexibility to address staffing needs, permitting after-hour construction for critical infrastructure, supporting the College of Physicians and Surgeons of Ontario who have allowed for the temporary certification of qualifying physicians, and permitting restaurants with a liquor license to include alcohol along with a takeout or delivery food order. With the creativity and innovation of Ontarians and a government eager to hear from the front lines, I know this new web portal will help us tear down any roadblocks standing in the way of the most effective response to this crisis. Thank you very much.
We'll go to the phone line for questions. One question, one follow-up, please. First question.
First question comes from Matt Simard from CBC. Please go ahead.
Hi, Premier. The Quebec government announced yesterday its timeline for reopening schools, and it seems like Premier Legault is willing to take more risk and to lift restrictions faster. What do you think of the approach in Quebec?
Well, that's going to be up to Premier Legault. We're taking the advice off our Chief Medical Officer and our health table and our health experts, and we don't want to put our kids at risk. That's really what it comes down to. I'm not going to put our children in a classroom, crowded classroom. I'm just not going to do it. We've got to protect our children at all costs, and we'll make that decision by the end of the month as we come forward. But no, I wouldn't do that here in Ontario.
And so far, the federal government is leaving each province to figure out what's the timeline for reopening businesses and restart the economy. Do you believe there should be a national approach to relaunch the economy?
Well, we had that conversation with the premiers the other day. I'll be speaking to the Prime Minister today, and all regions are different. BC's a little ahead of us, as well as maybe the other areas, Saskatchewan, but we're a whole different area here in Ontario. We have a much larger population, 14.5 million people, compared to provinces that have 2 million people. So it's a whole different ball game here. Our number one priority is going to protect the health and the well-being of the people of Ontario. We'll be able to get to the economy as soon as possible once we see the numbers decrease.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier.
Hi, Haley.
In the past, banks and oil companies, they got bailouts because they found themselves in tough positions, often of their own doing. And we've been speaking with restaurant owners wanting to know where their bailout is. They say they're the victim of something that's completely out of their control, and they don't even know if they're going to last another 2 months. They want a bailout. They say the wage subsidy, the rent relief plans, and the loans are doing absolutely nothing. And if a bailout is not coming, they want a detailed explanation as to why, and the government, to be honest, that the plan is actually for them to go bankrupt. So in your discussions with the Prime Minister, has there been any talk of a bailout for restaurants?
Well, I think overall, when you're looking at restaurants, first of all, my heart breaks for the restaurant owners. They employ hundreds of thousands, if not probably close to 1 million people, and I understand they're struggling. What we did do is we gave them the opportunity to have takeout food, deliver alcohol. We put $10 billion of deferrals towards all businesses, opposed to one sector. And we're going to continue on the rent. It was over a $900 million, if you want to call that a certain bailout as well. That's a tremendous amount of money. And again, trying to keep the facilities that they're renting open. That's the number one priority. I will mention it to the Prime Minister about the restaurants. And I'll do anything I can to help people, but we only have certain capacity, financial capacity here at the province. We could go on forever on lists, but again, I'll do everything I can to help out the restaurateurs and that whole sector.
And my follow-up question regarding the $4 an hour pandemic pay increase that was announced over the weekend. As security guards, let's say at banks or condos or hospitals and homeless shelters, et cetera, they're essential, and they want to know why they were not included in that pay increase.
Well, again, we focused on the 350,000 people that have direct contact with COVID patients. And as far as I'm concerned, those people, and I've said it from day one, I've said it many times, they're underpaid. This is just a small token of our appreciation that we can show over a 16-week period that they're able to earn an additional $3,000, I think is $560. And it's just showing our appreciation. We're so grateful for the hard work, the healthcare workers and other people that are involved in taking care of COVID patients, going in there day after day after day, even though they're exhausted, putting their lives in jeopardy. And that's a priority for us, the 350,000 frontline healthcare patients.
Next question.
Healthcare workers.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi, Alison.
On small businesses, you say you want to do more to help out small businesses. Mm-hmm. We know that there are some who don't qualify for the programs already announced, such as the commercial rent relief program. What more are you considering doing to help such small businesses, and would you consider suspending commercial evictions during this period, as you've done with residential?
Well, as I've always said, Alison, everything's on the table. Any way we can support small businesses. They're the backbone of our economy. They're the backbone of this province, and millions of people are employed in small businesses. So everything's on the table. We continue to review that, and we're going to continue speaking to the federal government for assistance on that.
Thanks. And on your reopening plan, a couple business groups yesterday, generally praised the various stages that you've laid out, but said that as businesses reopen, they want to see an adequate supply of PPE for employees. Given the challenges that Ontario has had in pretty dire straits up until recently, is that something that is going to be feasible for the province to guarantee an adequate supply of PPE for businesses as they reopen?
Well, again, we're working day in and day out to make sure that we source PPEs around the world, along with domestic supply. Domestic supply is gearing up, and some are actually manufacturing now after changing over their production lines. And I've had conversations, matter of fact, every single day I have a procurement meeting, roughly around 10 o'clock, and we go through every single item, where it's coming from, what the supply is, what the forecast is. I think we're pretty organized on that end, and the forecast does change. It's going to increase. We also had the conversation with the largest food companies the other day, and then a lot of the manufacturing companies this morning. I was on a conference call, and matter of fact, there was a couple companies that supply N95s that were on that call, and I emphasized, we need you to open up a manufacturing facility here in Ontario, because if they don't open it up, other people will open it up, and we're going to make sure that we buy off Ontario companies moving forward when it comes to PPE. We'll never rely on a foreign government again to be put in this position. Right now, we do have enough PPE for our frontline healthcare workers and other areas that are critical for PPE, but right now we're going to have to look at continuing manufacturing here in Ontario, and that's what our key focus is on right now, to support the private sector as well.
Next question.
Next question comes from Randy Ratt from CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. Speaking of the 350,000 frontline healthcare workers, the province's radiation technologists and the sonographers have sent you a letter saying that they weren't included in the pandemic pay fund and asking to be included in that. Is that something that you're willing to look at?
we're always willing to look at everything. We're on that one, Randy, but there's so many people out there. I just want to make sure that we take care of the 350,000 frontline healthcare workers. I understand they're part of it, and we'll be reviewing that over the next few days.
Okay, thanks. As far as your plan to reopen the province, your roadmap, there seems to be two separate outbreaks of COVID in the province. One in the long-term care facilities, and one in the general public.
Yeah, there is. We're living under two worlds. One, long-term care, and other facilities with congregate living, and then there's the public domain. Public domain, everyone keeps working hard. We're seeing results. Long-term care, we're working extremely hard at long-term care, putting resources in there. But really our goal is to see a downward swing when it comes to the testing every single day. And if you noticed, so we had 3 good days, and then all of a sudden today it spiked up again. So we need consistency right across the board to see downward slope over the next couple of weeks. That's absolutely critical.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier. Just want to follow up slightly on what Randy just asked you about. The percentage of people that are coming down with COVID-19 out in the community, according to Dr. Williams, is roughly 50 or 60%. So these are people contracting it outside of the high-risk settings like long-term care or healthcare workers. How concerning is that figure, and what does it say to you that still, even though there's all this physical distancing going on, that still so many people out in the community are contracting COVID-19?
Well, that's why we keep saying that we have to continue practicing social distancing, self-isolation. That's absolutely critical. I know our announcement, a lot of people thought we were going to be setting dates and that, but right now we can't give an exact date because I don't know the exact date. And as soon as I find out, within a minute, you'll find out as well. But the Financial Accountability Office came out with a report today saying if we didn't act, and I always say, Mike, when I say we talk as a province, not as a government per se, but we as a province, since we acted so quickly, we saved thousands and thousands of lives. And that's why we have to be so careful about opening up the economy. And we're going to be very, very careful.
And then if I could follow up on another topic, this is actually from Minister Elliott. For Minister Elliott, I'm just wondering if, in relation to the Financial Accountability Officer's revelation today about the number of elective surgeries, scheduled surgeries that have been postponed, what's it going to take for the province to be able to deal with that backlog? How difficult is it going to be given that there have always been these, delays in elective surgeries?
Well, we're already starting to deal with that, to plan for the surgeries that can proceed that have been postponed. Cardiac care and cancer care probably being at the top of the list. I know that this has been very disturbing for many people who want to get on with their surgery. But again, we can't do it until we know that the peak has plateaued and that we see a trend to a lesser number of cases coming before us. As the Premier indicated, we saw 3 days where we had a decreasing number of cases, but they increased by 101 cases today from 424 to 525. So we want to make sure that we're not going to have increasing pressure on our hospitals with COVID-19 cases before we can start opening up those surgeries. But it is one of the top issues that we're dealing with right now because we know it is so important for so many people. We've heard from hospitals, we've heard from associations letting us know that they want to proceed with those cases. So that is among the first things that we're going to be considering as we look towards easing up the economy. But we do have to see that downward trend in cases first before we can do that.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
You mentioned off the top you'll be releasing some sort of labor guidelines later this week. I'm just hoping you can expand on that, on what kind of guidelines you'll be providing businesses and which sectors you'll prioritize in these guidelines.
Well, we're going to bring that out later this week, Laura, and if I can ask you, just stay tuned. I don't want to release it now, but over the next few days, we'll be putting out guidelines. They'll give the opportunity for businesses to have a clear guideline when we do open up, what needs to be done to make sure we have a safe working environment for all employees right across this province, and a consistent guideline.
Follow up?
And just regarding your comments about Quebec at the beginning of the press conference, when you talk about why your plan didn't include schools at all, is that because we don't know how the virus impacts kids yet or how it spreads? Can you expand a bit more on your concern, particularly when it comes to children?
Well, children are the most important people in our society. We got to protect our children. The children can't protect themselves. They rely on us to make a decision. And no one wants to put our children in harm's way. And I'm just not willing to chance it. Just not willing to chance it. They're, they're resilient, but still, let's wait until the end of May, and then we'll make that determination if we're going to continue on for a few weeks going back to school, or if we're just going to scrap the rest of the school year. But again, that's going to be their choice in Quebec. That's not our choice.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Good afternoon, Premier.
Hi, Travis.
You talked about the downward trend that you want to see in order to start rebooting the economy and pressing the reset button. What have you been told about the threshold when it comes to number of cases, the daily increases, in order to initiate stage one? What has Dr. Williams and the medical experts told you?
Why don't I hand this over to the Minister of Health? Thank you.
Well, it's really not a number of cases per se. What we're looking at is a downward trend. So if we still keep seeing hundreds of increases in cases on a daily basis, that tells us that there's still a problem both in the community. We know there is in long-term care, but we need to see those numbers going down consistently. There may be blips in the system from time to time, but we definitely need, and Dr. Williams needs to see, a downward trend, not just a coincidence from day to day. It has to be a trend going downward before he's going to feel comfortable about allowing or making the recommendation, I should say, for opening up the economy, because we all want to make sure that Ontarians are going to be safe, and we need to see that before we can open things up anymore.
Okay, and I guess this question is for you as well, Minister O'Rourke. Dr. Fulton is there. Can you explain the government's rationale in not taking over long-term care homes where there are outbreaks, and why don't you think this move is necessary?
Well, we discussed a number of options, but came to the conclusion that the path that we've taken is the best one for the people of Ontario. First, we asked the armed forces to come in to assist us, which they've done, and we're very grateful for that. They have gone into 5 long-term care homes now. And we also had the emergency order last week that allowed hospitals to send in some of their people into long-term care homes. A number of them had already been doing that voluntarily, but it just wasn't happening quickly enough to get the number of people staff-wise into long-term care homes that we needed. So that's why we proceeded with that order. And I know that a number of hospitals are already participating. And that is the quickest way to get experienced people in there, and that is already helping. We know that many long-term care homes are grateful for the assistance, and to have the staff there with the necessary personal protective equipment as well.
Last question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier. How are you today?
Good, Cynthia. Good. How are you?
You referenced the FAO report, and it says 52,700 surgeries have been postponed due to COVID-19. I've learned that roughly 1,700 cancer surgeries have been postponed in this time. Have you ever received a report or anyone saying that there could be some collateral deaths as a result of these postponements?
Well, it's something close to both of our hearts, and I've faced this in our family with my dad, my brother, and my mother. There's no one that wants to get this done more than I do, but I think the appropriate person to answer this would be the Minister of Health.
Well, any death that's happened as a result of COVID-19, whether directly or indirectly, is a tragedy. We feel for those families who've lost family members, whether it has been from cancer death, a cardiac death, or a COVID-19 death. But these were decisions that we had to make. The decisions were made by medical personnel based on a pandemic plan that had been drawn up many years ago. And so we wanted to make sure that we protected as many people as possible. There may be some people who die because of cardiac or cancer deaths, but we also saved thousands of lives by moving as quickly as we did. So as tragic as it is, these decisions were made by the medical people involved with people's cases and based on that pandemic plan.
Minister, this is for my follow-up. This is the first time I've heard you acknowledge that there actually could be some collateral damage, some collateral COVID deaths. Are you hearing this? Have you seen any reports of any deaths due to cancer or heart attacks because there were a postponement of surgeries and procedures?
Well, I understand that a report has been released today by UHN with respect to cardiac deaths, and that has been estimated that approximately 35 people may have passed away because their surgeries were not performed. That's not something any of us want to hear. Certainly was not intended because the best medical decisions were made. But as I've said before, any death is a tragedy. So it's something that has happened. It is, I don't want to call it collateral damage because they are deaths. And that is very concerning and sad to all of us. But we were required to make decisions, as the Financial Accountability Officer said today in his report, that because of the space that was created in our hospitals and the decisions that were made to make sure that we had enough acute care and critical care beds and ventilators available for people with COVID-19, that thousands of lives were saved there. But as I said before, any death is a tragedy.
Okay, thank you.
Thank you, everyone.